I have this article from yesterday I didn't get to. But listen to the headline from the Daily Caller. This all affects you. It all affects you. Obamacare hurts parents of special needs children. President Obama's Affordable Care Act, writes Patrick Halley, known as Obamacare, will make it more difficult for parents of special needs children to pay for tuition at special schools and to purchase medical equipment, according to a new report. More than 30 million Americans place money into a pre-tax flexible spending account, an FSA, through their employers to help save emergency funds to pay for their family's medical costs. Obamacare institutes a brand new $2,500 cap for FSAs, which will make more money taxable and could raise $13 billion in taxes for the federal government over the next decade. Well, that's why we exist. Not to put money aside for our kids. Not to put money aside for special needs. No. For the government. Before Obamacare passed, there was no limit to how much money you could put into your FSA at work. Ryan Ellis, tax policy director, said for the Americans for Tax Reform. Most people don't. But the one group that does put a lot of money into their FSAs, parents. Parents of kids with Down syndrome and parents of kids with physical disabilities. Currently, if parents send their kids to a special school, the tuition is considered a qualified medical expense that can run through your FSA. So if you have a kid who needs a durable piece of medical equipment that's not covered by insurance, you can run that through your FSA. If FSAs have any limits before Obamacare, they were determined by the employer. The IRS had nothing to do with it. But Obama created a new $2,500 cap. So that's not going to affect most people who just put in enough to pay for eyeglasses or dental work. But those people with children with especially difficult and expensive special needs, they're going to take it in the neck. Why? This damn bill is a poison in this country. It's a cancer in this country. This has nothing to do with more people on health care, taking care of this group or that group. Do you realize how many people are going to suffer as a result of this damn law? Nothing compassionate about it. It's all propaganda. Oh, here's another one. Investors Business Daily. I pulled this from some time ago. An unintended consequence. Oh, all these unintended consequences of Obamacare. Centralized big government sucks. Wait till we get to the economy. An unintended consequence of the abomination that is called Obamacare is the dropping of wives from husbands' employer-provided health care insurance. It's a de facto war on women. Obamacare is filled with grinding mandates. One of them requires that children remain covered by their parents' health plans until they're 26, when their parents' insurance provides dependent coverage of children. The government calls this protecting young adults, but insuring children long past the day they are dependent on their parents exposes companies which will bear the added costs of paying the inevitable higher premiums, and in some cases, the extra expense could be significant. So at many companies, something has to give. And quite often, the rational response to rising healthcare costs is to drop spouses, more specifically, wives, from insurance plans. Sometimes it's the husbands who must go, but benefits experts have confirmed to MarketWatch that those who are kicked out of plans tend to be women. So there's another unintended consequence of this cancer called Obamacare. Wait, I've got more. I've got more to celebrate. The Washington Examiner, the great reporter Paul Bedard from yesterday. The administration has popped the bubble of hope some small businesses had that switching a part-time staff would let them escape the high costs of Obamacare. The Small Business Administration created a website to explain to businesses that the government will simply tally up the number of part-time employees. Firms have to determine if enough hours have been worked to essentially create a full-time equivalent. Some smaller businesses had thought they could get around under the 50 full-time employee cap, that activities Obamacare that activates it, by cutting full-time workers and hiring more part-time workers. Several business groups had been warning smaller firms of the provision in Obamacare, but many were confused and waiting for the administration to finally explain the so-called employer mandate calculation. While it's nice the administration has launched a new website, employers have been scrambling since the law was passed 2+ years ago for answers. Well, now they have an answer. So here's an example from the SBA website. You ready? Example, Company X has 40 full-time employees working 40 hours per week, along with 20 part-time employees working 15 hours per week. The 20 part-time employees are counted as 10 full-time equivalent employees. In other words, they add up all the hours. And if it adds up to a full-time equivalent, boom, you're covered by Obamacare. So special needs kids, wives for the most part, small businesses. This is just the beginning. I mean, I could go back and it's just endless. Remember we caught Boehner 5 or 6 weeks ago and Harry Reid trying to figure out a legislative fix? These phrases on Capitol Hill are pathetic. A legislative fix to their little Obamacare problem. Remember we caught them? Remember how we drew outrage to this and drew attention to it? Well, these people are sleazier than... I mean, they are so lucky that we don't storm that building. I am not encouraging it in any respect. But you want to see the difference between we, the people, and them? And listen to how Politico writes this. And the media in Washington, D.C. are celebrating this as important and defending every damn piece of it. John Bresnahan and Jake Sherman. Lawmakers and staff can breathe easy. Their health care tab is not going to soar next year. The Office of Personnel Management, under heavy pressure from Capitol Hill, will issue a ruling that says the government can continue to make a contribution to the health care premiums of members of Congress and their aides, according to several health sources. Now, let's stop right there. If this Obamacare law, it's not a law at all. It's just like Jell-O. First of all, they were issuing waivers to a couple thousand of their best friends. Remember that before the election? Mostly unions. Union bosses, what a bunch of suckers. You union members, they sold you, I tell you, for nothing. And they're campaigning for Obama. They're donating to Obama. They're demanding Obamacare, and a year later it's oops. Well, oops, too late, dummies. Capitol Hill, they pass a law they don't even read, which affects every single one of us, every family member, every friend, every neighbor. I just read you 3 scenarios right now, and there are more about what's happening out there to our fellow Americans. And people are being dropped from their health care. People are desperately looking for new health care. They don't even know what the hell a state exchange is. And here we are, in anarchy, in chaos. And what is Capitol Hill worried about? Their own health care, under the bill they passed. So what do? They go to Obama. What does he do, the imperial president? What does our soft despot do? He tells his agency, the Office of Personnel Management, forget about the law. Do an interpretation. Just interpret it differently. And they interpret it to subsidize themselves.